Doctor, when's a good time to start treatment for conditions of perimenopause or menopause? Is it before the symptoms start? And then if that's the case, how do you know when the good time is?
Well, it's a very good question. From my vantage point, the ideal time to begin is right in the beginning. And yet, no matter when a woman intercepts this process, whether it's 10 years without hormones or 20 or 30, even women in their 80s and 90s, uh, all of those can be decent times, sometimes really important times to treat.
Hmm.
But in the early years, when a woman's getting a little irregular and her cycles are a little different, like there's a lot of women who have very regular cycles throughout their young life, and then all of a sudden their cycles start getting a little irregular. That is the ideal time for for them to be uh, uh, supported by someone who knows what they're doing,
Hmm.
because usually what's happened there is they've stopped ovulating or they're intermittently ovulating. And in that case, when they're not ovulating, they're not producing progesterone. And progesterone is a very significant balance to estrogen. And when you have unbalanced situation where the estrogen symptoms of overstimulation dominate, then these women get breast tenderness, overstimulation of breast glandular tissue, overstimulation of the uterus, and they can develop uterine fibroids, which is one of the most common thing that happens.
Hmm.
But if someone is perceptive enough or proactive enough to go, look at this, my cycles have changed. I wonder if there is something I ought to tend to here, and they wind up with someone who's savvy about menopause, that practitioner is going to know that they're not ovulating. If you institute progesterone at that time, you do a world of good.
Hmm.
When I was in medical school, we were taught that the average age of cessation of menstruation was about 45, and the average age of cessation of ovulation coincided with the average age of cessation of menstruation, and that marked the beginning of menopause. But nowadays, because of all the estrogenic type substances, toxic in
Hmm.
our environment, and for other reasons, women can stop ovulating as early as 35, whereas the average age of menopause, of stopping having periods, is still 45 to 52, depending on who you read. That means they can have 10 years where estrogen effects are dominating,
Hmm.
not balanced by progesterone, and that's when they get the fibroids, and from the fibroids many women have their uteruses removed, and that's no picnic. It's not
Hmm.
the end of the world, but it's problematic. And so if you could get that progesterone in early, right when a woman stops ovulating, it's one of the biggest services that can be done for a woman in
Hmm.
menopause.
The whole ball starts rolling when the body starts to reduce its production of progesterone. Is that correct?
Well,
And then
yes, and
that
it's
and
a
therefore
rather
the
abrupt
imbalance.
thing.
Okay.
In order to produce the rich levels of progesterone that young women you have to ovulate.
Hmm.
If a woman has a cycle where she doesn't ovulate, she does not produce that progesterone. So it's rather abrupt. And they feel it is rather abrupt. They say, gosh, I've had regular periods all my life. And now I'm getting a little irregular, I'm getting a little crampy, I'm getting a little breast tenderness. It's almost like I'm going in through the onset of menarche. Right from the beginning again. What's happening to me? Maybe I'm getting younger. I don't think so. And so it's rather abrupt. And it doesn't happen every month in the beginning, because some months they ovulate and they go, oh God, I'm back on track. And then they don't ovulate for a month or
Hmm.
two or three. So there's all kinds of variations that can take place, but boy, is that an ideal one. So much good could be done if women at that time, they can get over-the-counter progesterone creams. And boy, if more women knew that and did
Yeah.
that, it would save them a tremendous amount.
Hmm.
And would save American healthcare an
Yeah.
enormous amount. So it's a really excellent question. It's one of the most wonderful things that can be done and over the counter.
When a woman starts to notice these symptoms, how big is the mental hurdle to actually go in and get treated? Because that almost says, okay, look, I know I'm getting older, and a lot of people don't want to admit that. Do you find that that's a big hurdle just to get started on treatment?
Well, this is something I actually don't know, because I have a very skewed outlook. By the time they arrive in our office, they somehow have bridged that
Sure.
particular question. So you're probably asking a question of something that takes place out there, but only
Mm.
the ones who are shy, they're
Mm.
the ones who know it.
Well, on average, what do you see? Do you see women that are are far down the path then, or do
All
you see a lot
ages.
that have started? Have just
All
do you?
ages. Yeah. Uh, all ages.